So this is Kerry, and she's going to talk about community management of herbal medicines as healthcare. Take it away.
Thanks, Tamsin. Thanks, everybody, for being here. So I'm Kerry. I'm continuing the herbal theme for this section, but I'm coming from a slightly different angle in that I'm not going to talk to you about individual herbs. If you want to talk individual herbs, come and talk to me later. I'm actually talking about the clinical practice of herbal medicine. So I am a practitioner. I'm only a baby practitioner. I only actually started work with herbal medicine 7 years ago. So I'm still a baby when it comes to herbal medicine, but I love it. I also am with the National Centre for Naturopathic Medicine. Those are my supervisors who are awesome, like I think all supervisors. I would like to acknowledge and pay my respects to a range of traditions, in particular the Waka Waka, Yinabara and Yagara peoples, who are the custodians of the lands on which I live and work. But I also want to acknowledge my Celtic ancestry and the elders and holders of traditional Celtic knowledge, particularly when it comes to herbal medicine. I must acknowledge the plants. Gets into woo-woo, but you can't be a herbalist without plants. And as I explain to a lot of my clients, I actually don't have a natural affinity for plants. I'm a book person. I'm an indoors person, but the plants themselves have been teaching me all sorts of things, like if I plant a plant over here in my garden, it's not the right place. So they actually take themselves over here. And so I now have plants growing in my herb garden in completely different area to where I thought they were going to grow. And finally, I also have to acknowledge the people in my own home area, the Somerset region of Queensland. They've come along on this journey on looking at management of clinical practice and community management. So in fact, I, as of 2 months ago, no longer manage the herbal clinic. My community manages it. We have a cooperative that manages the clinics, and they will be moving on from here, making decisions about what days I practice or what days the clinics operate, which towns the clinics operate in, what other practitioners we invite in to work from a holistic perspective, and go from there. And when I started to look at that model, I did what most people who are starting out knew was something, went, good, who else is doing it? What can I learn from? Where's the handbook? Where's the guidebook? And there wasn't one. So basically, what I'm going to present today is not that full model. Again, if you want to talk to me about it, please come along and I'll bore you to tears. I really will, because I really do love it. But basically today, just a little bit about the context of my study. The scoping review, which is the first step, which I'm in the midst of doing now. The progress I've made so far with the scoping review, which is not quite as much as I would have liked to have thought, but that's normal. And some of the learnings that I've had and some of the challenges that I've been facing and facing. So basically my PhD is asking, what is community managed herbalism? What are its key characteristics? What are the theoretical assumptions about it? What are the experiences of people who've been involved in it? The extent of consensus that herbalists globally can reach about what that term means? And where does community managed herbal medicine fit within healthcare systems? Sorry, we're herbalists. We're not going away. People have tried, but we're not leaving. In my initial literature review for things, basically the gaps were, there's very little research about the collaborative nature of herbal medicine practice. There's very little about explanatory concepts of what is herbal medicine practice. We lack definitions. And we have information about community-based coalitions, but not in herbal medicine, which is a great start for somebody who's trying to work in that area. My methodology are 3 broad phases. The first is a more formalised scoping review. some case studies to examine. And this is one of the interesting things, was that I know of herbalists who are doing this work. I know of communities where it's happening, but nobody's written about it. I had to find it from contacts, through professional associations, through Facebook groups, and there are some herbalists who I must admit, sorry, I'm going to go into like little kid excitement here of, I had a chance a month ago to talk to like one of my guru herbalists via Zoom, because we were talking about my study. And it's like, this is the kind of thing you sort of make those connections, but it's not been written about. And then ultimately, I'm going to be doing some Delphi methodology with herbal medicine practitioners, because I'm trying to come up with a definition that we can use about what is this thing called community managed herbal medicine. I started out with community supported herbal medicine, but didn't quite fit with what I'm doing, because what I'm doing is actually handing the management to the community. It's not me as the practitioner who's ultimately in charge, which from a healthcare perspective is, it's not really me as the practitioner who's in charge of my client's health, it's them. So they're the ones who are managing their health with my help and my support. And so similarly with healthcare in the community, ultimately it's the community who's in control, or should be, in my mind, in control. So I'm talking to you today particularly about my scoping review, because I'm in the midst of it. And for an academic, anybody who's academically inclined, it's kind of like nirvana. People have said to me at various times, oh, look, you know, oh, you're doing your PhD. Oh, you poor thing. Oh, they're going, oh, yeah, I can see why you're giving up being president of that association or doing that, because you're doing your PhD. And I'm just going, you know, I'm in my happy place. When I'm stressed, I go and read another paper. But basically, you know, obviously a scoping review, the aim is to map the existing evidence. I find it hard to believe that I've come up with something that's completely unique. It's out there somewhere, so there must be some evidence somewhere. So it's systematic. Obviously, it's academic. I can't just go onto Google Scholar. Actually, if you go into Google Scholar and type in community managed herbalism, you get nothing. So it's a systematic search, and it's providing a descriptive summary of the literature that's out there. It's not evaluating the quality of it. It's just describing what's there. I'm looking at databases and on professional associations. So I'm going to academic and grey literature. I have to say, from a preliminary, what I've been reading, other PhD theses seems to be the predominant research that looks at things that touch on what I'm looking for. Maybe we PhD students have that luxury of looking at something that nobody else is really looking at. So that's just kind of an initial. The idea of analysis is I'm looking for key themes that come out in that. Hopefully some of the key concepts that might emerge about what this thing of community managed herbalism is, and hopefully some practical examples. Where is it being studied? So far I can tell you that out of 6,500 papers that we've done that came up from the initial search strings, one paper has a model that I knew about before I started, and that was one of my, yay, I know this clinic, and that there's finally a piece of academic research into this clinic. Way, how exciting. I did register a protocol, so which is really, that was quite an interesting process of registering a scoping review protocol and writing it in exactly the right way and getting it through. And it was actually very rewarding for me when I reached out to one of the professional associations that specifically studies and hosts researchers of natural medicine, to have them say, thankfully, they were so happy to pass it on to their members because this was something that knew what a scoping review was. So that was really, really nice validation that the work that I'd done, thanks to my supervisors in crafting and recrafting and defining and redefining and rewriting and rewriting and rewriting and redoing it and doing it again, actually paid off because it was something that was academically credible. So the aims of my scoping review are, to what extent is herbal medicine used within community healthcare clinics? So we do have around the world community healthcare clinics. There is a definition about what they are, and the definition that I'm using has as one of its key features that 51% of the management committee of that clinic must be members of the community, not practitioners, but members of the community. Yes. Okay, thank you. What evidence exists and what does it tell us? That's the scope, that's the protocol. Big King was building the search strategy, defining the concepts. What did I mean by community-supported clinical practice? What did I mean by herbal medicine? Go through lots of, there's all these terms that all mean the similar types of things, but you have to document them all to make sure you're getting the right ones. An example search string and an example of the testing runs that I did for the search strings and the types of results that I got when I changed the strings around slightly. I used a range of academic databases. I did quite a bit of, I've been doing quite a bit of grey literature searching, so emails to professional associations, sending out thousands of copies of my scoping review protocol, a few Zoom meetings with people saying this is what I'm doing. Please, do you know a herbalist or a naturopath or somebody who's working with herbs in a clinic that has members of the community involved? And ultimately, I will be doing reference reviews as well and going through the reference lists, particularly of those references that come up at the final stage of the review strategy. Just the results I've broken down into the different databases and what I've got. Basically, 8,611 in one of the first runs, which got narrowed down to about 6,500, which made one of my supervisors who doesn't like doing screening go, what? No, there can't be that many, no. And I reassured her, it's okay, most of them are going to be just, no, not relevant, not relevant, not relevant, not relevant, even on the title and the abstract, they're not going to be relevant. So I'm using Covidence as the tool for doing it. This was done, I took this screenshot about 2 weeks ago. So I've actually now, we're at the full text review stage of screening. So we started with basically starting from the 4,326 of the were immediately irrelevant. We're now doing, we've got about 690, I think it is, in the full text review. So I've actually now only got about 150 to read full text of. So what have I learnt so far? Test, test, and test, and test, and test, and test, and test the research, the strategy. Stick to the definitions. So clinic. And, there's all this over here that, is that really a clinic? Well, maybe. No, it's not a clinic as per the way you've defined it in your scoping review, so it's irrelevant for the scoping review, not necessarily for the broader project, but for this particular part, stick to the definition. Librarians are amazing people. Oh my God, I've got this little obscure text from 1953. Do you know where I can find it? 2 days later, there it is in your inbox. Oh, wow. And it always takes longer. I was publishing in January this year. So basically what I've learnt, schedule. Take some time, adjust your schedule, be prepared to review the schedule, but always put time aside. I can do it in half an hour block. How many texts can I screen in half an hour? Oh, please, I've done my half hour. Please, can't I just do another 45 minutes? No, I said half an hour. Record things. So I found some texts that don't fit the scoping review, but have some amazing stuff for the rest of the project. So I've had to work out with Excel spreadsheets, have multiple. I've just got this massive big workbook now. What do you do with the things that don't fit? So the clinic example is one. One of the things I've learned is that we talk in the Western world about a clinic as the practitioner and the client. That doesn't fit where a lot of community herbalism happens, which is in the non-Western world, in traditional societies, where the clinician is not necessarily called the clinician, and it's not necessarily done in a separate building, in a little room, but it fits the whole thing of community managed herbal medicine. So that's where the recording comes in at this stage. I don't want to lose it in my thousands of references, so I record a whole lot of that in my spreadsheet so I can come back to it, because it doesn't quite fit there. But potentially in terms of the write-up and that with the scoping review, I'm going to be saying and acknowledging that I've actually had to consider changing my definitions, because there's a whole lot of literature that covers something that doesn't really fit the definition I started with. And how do you find grey literature when other people just don't want to play? Right, you write to a professional association, say, please can you send out this information to all your members? No. Don't even give me any room to negotiate? No. Or, oh, we want you to pay. Or, no, it's just not relevant. Yes. And that was my last slide. Thank you very much.
Thank you so much. That was really awesome. I think a lot of us are looking at helping communities out in the middle of Australia where there's no one else to help and there's no, doctors around. So, yeah, I could just see the incredible potential of that project. It's absolutely awesome. And your enthusiasm for research is inspiring, but maybe a little bit intimidating too as well.
I'm a geek. I mean it. Geeks Anonymous, that's me.
Yeah, thank you so much. Does anyone have any questions? Yeah.
Kerry, that was fantastic. And you definitely hit, we were having a good little giggle over some of the things you're saying because we feel you. It does take longer. If you watch my presentation tomorrow, you'll see. And we feel you on the search terms, and you've done such a good job of putting it together and just the way you've laid it out, and you've just gone so in depth, and we applaud you on that, because you've ended up with a lot of articles to screen. I think I only got 8 at the end of the day. I don't know how many you got at the end of the day.
I think at the end of the day, when it comes to the final, there's probably going to be about 10 or 15 that will actually make it right to the final cut.
Yeah, but even going through that, it's a huge project to say. It's congratulations on getting to where you are, and just know you're progressing so well, even if it's not where you want to be. So.
Any other questions, comments?
I was wondering, I didn't quite understand what protocol was. You said
okay.
Protocol that got registered?
Yes, so in the process of doing a formal, so the question for the audience out there and recording is, what is a protocol? Yeah, good, so when you're doing a scoping review or a systematic review, you develop a protocol, which is basically, this is my plan. This is how I intend to do my scoping review. These are the sources I'm going to go to. This is the search strategy I'm going to use. This is how I'm going to analyse the papers. This is how I'm going to screen the papers. And so you then register that with, if it's a systematic review with, say, Cochrane database, Open Science Framework is another one. And so you register that. So it's basically saying to the academic community, here's my plan. And nobody else can do it while I've got this is my plan. And if you want to do something similar, but you've got to change it because you can't do my plan. And then after you've done it, that's when you can then do your write-up and you do your publications that say, here it is. And if you divert from your plan, you acknowledge the plan. So a protocol is just a plan.
What is the software that you use for the systematic review called?
So the software that I'm using for the review, and that is called Covidence.
Is it free? Like,
It's the university has a subscription to it.
I didn't use it. Did you like it?
I quite enjoy it. Yeah, it's fairly simple to use. It builds up the prisoner diagram for you. You can set up the rules. So basically, myself and my 2 supervisors. So we have 3 screeners. So you set the rules so you say that nothing goes through until 2 people have screened it. I screen, but I can't see what the other people are doing with screening until you get to, it tells you when there's a conflict, and then you work out how you go in to manage that conflict. So it's, yeah.
Oh,
Yeah.
okay. And I've been a while though.
Yeah.
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 So it takes longer.
Yeah. And I, just a final comment, I really like your librarians are awesome. They are just waiting to hear from research students. And so please call on them with questions like yours. Yeah, they just, it makes them come alive, I think, when they get a question or a research student wanting assistance about something. So, yeah, please contact your librarians.